Good evening, IPE judges. My name is Kendall Conway.
My name is Savannah Tallman.
And I'm Topolski.
Tonight we're going to present to you our case presentation. So our case study title, A Downward Spiral, a Case Study in Homelessness. Our patient's name is John Jones. He is a 36-year-old male, and his chief complaint was shortness of breath and a cut on the arm. Our brief narrative is that patient John Jones, a 36-year-old male, was found outside during the winter months complaining of shortness of breath and a cut on his arm. Our primary learning objectives, we chose values and ethics first. This objective is important for John's case because his treatment will continue and involve more healthcare professionals than the average patient. His care will demand the equity of all healthcare professionals involved. Supporting John throughout his journey will require different healthcare practices whose professionals must work together to ensure the best personalized treatment. We also chose roles and responsibilities. John's treatment plan will involve a variety of healthcare professionals. Each professional will have their own scope of practice and must recognize when to involve another professional for their expertise to further John's healthcare experience. The next we chose was interprofessional communication. In order for John to experience the best care, all healthcare professionals must be on the same page and communicate respectively with each other. A great example would be the MDPA and PRN at the emergency room communicating with the healthcare for the homeless advocate and hospital social worker to continue his healthcare outside of the medical facility. And finally, we also chose teams and teamwork. Ideally, a hospital social worker would first screen for homelessness. Upon discovering John's current lifestyle, the hospital social worker and their team would assist in directing John to the most cost-beneficial program for his medical treatment, namely healthcare for the homeless. John would also report to see a provider for treatment and prescription for his infections. Given John's alcohol-induced lifestyle, it would be most effective if he were admitted to a rehabilitation clinic. Here, John could properly detox from booze while his injuries are being treated. And John would also be able to spend time doing 12-step work, learning how to properly function as a member of society again, as well as a dependable family member and a respectable father for his children. Once John has completed his rehabilitation successfully, it would also be beneficial for him to move into a halfway house. There, he could also learn how to live on his own without the dependency of alcohol with a group of individuals in similar situations. John would also become aware of support groups in the area where he could attend meetings, help to find a sponsor, and also build relationships that support a stronger network of like-minded individuals.
John Jones is a 36-year-old homeless male who was approached by a nonprofit organization outside during the winter months. He expressed shortness of breath and a cut on his arm, and John's medical history showed numerous emergency visits. The patient was treated for a sinus infection, numerous cuts and injuries, and cellulitis. John's record shows that not all antibiotic prescriptions were filled or completely filled. There is no family medical history on file for John, but the patient identified daily alcohol intake as above average to the normal person and had no consistent shelter or food supply. Upon physical exam, John had an infected cut on his left arm, as well as numerous cuts and bruises on his whole body. Lymphedema was severe in his legs, arms, and chest as well. His lab results showed that the patient's blood alcohol content was 0.161. His total blood count was above average, and his C-reactive protein was high as well. And then moving on to the questions, what were some of the key pieces of information that were uncovered within this scenario? So the loss of John's job and family increased his drinking behavior to be even more out of control. His alcoholism led him to lose his family, house, and income, but knowing this only increased his depression. Previous medical records showed a series of care, including emergency room visits for the sepsis, cuts. During his last, he was treated for multiple cuts and was diagnosed with cellulitis. If he's not treated, these infections could lead to MRSA, staph, and sepsis as well.
To continue the questions, so we decided which professionals to include in this analysis by just walking through John's treatment. So we decided that first, John will need the healthcare for the homeless to go with him into the emergency room as an advocate so that he is properly screened for homelessness and alcoholism. Next, a social worker will be conducting the screening, and healthcare for the homeless will step in as well as an advocate again to explain the importance of him going to the healthcare for homeless headquarters. John's blood alcohol content was found to be 0.161. As John is leaving the hospital, he begins to have delirium tremors, or DTs, and a seizure. This shows the interprofessional team the seriousness of his alcoholism. The healthcare for homeless staff then explains the importance of going to a rehabilitation center. He will gain control of his alcoholism and the infections in the cut on his arm and shin. After he finishes a 6-month rehab program, he is set up with the affiliated halfway house. Once he is in this halfway house, he will be helped to find a new job. Income will allow John to increase his savings and potentially live on his own again. He will continue to attend alcohol support groups and stay in contact with his sponsor. So an interprofessional team would best help John because it would ensure that his healthcare continues well after he leaves both the hospital and rehabilitation center. So following medical treatment, John will continue to need psychological support to increase his quality of life. And then lastly, 1 year later, John's health will have changed for the better. John will have completed his 6-month rehabilitation program, and he will currently be living in the halfway house. While living in the halfway house, John has been attending weekly AA meetings and has even found his sponsor from the group. He has been working very hard to stay sober since he left the rehabilitation center. John has connected with an MD, an RN, a social worker, and most importantly, the team from Healthcare for the Homeless. Without an interprofessional team, John's healthcare journey likely would have ended at the hospital. He would not have been screened for homelessness, and he would not have acquired an advocate to further his treatment as an alcoholic. We just want to take a quick moment. Thank you guys so much for listening to our presentation in the case study analysis competition, and have a great winter break. Thank you.
Thank you.